Hello, pod people. I am Mike on the mic. We are here with Home Care, you say? We have our guest from the great state, the first state, Delaware, joining us
Very
today,
first date.
Senator Russ Huxtable. We
Hi.
are excited to have Senator Huxtable join, give some perspective from the legislative angle. We want to make sure you're informed every which way on anything that relates to home care. And he is going to step in today and answer some questions we have and hopefully clear some things up for you and answer questions you may have had. So, welcome.
Thank you, Mike. It's good to be here. Thank you for the invitation. I hope to enlighten the folks as you tried to illustrate there in your opening. I can't make any promises though, but I will do the best I can.
Sounds good. All right. Well, speaking of advice, let's go right there. What advice do you have for our listeners regarding best practices when advocating to their direct constituent legislator?
Okay. So this is especially true in Delaware. We are your neighbors. So some people think, oh, I don't know if I want to call my rep or my senator. Like, do it. Like, get on the phone, shoot an email uh, most of the time. And we're responding to emails as hopefully as soon as we get them, but there will be an influx. But like, we're a state of neighbors, and it's great to like, you know, uh, you know, I grocery shop at the same stores as everyone else does, so it's great to see people and engage. So don't let the it's not mysterious as far as in order to engage a legislator, just email them and call them up, or stop us in the grocery store.
Excellent. Well, speaking of engage, you're teeing us up here. This is perfect.
Okay.
What are the best avenues of engagement with someone trying to form a relationship with their legislator?
Yeah. So a lot of folks just they'll email me and like explain the issue. It all depends on what they're searching for. If they're just searching for like advocacy on a bill, they'll tell me their positions, and like I take that input. I appreciate getting that feedback because I'm not an expert on every single
Yep.
thing. And I'm here to represent my district and my constituents. So hearing from them directly on bills is important. A lot of times, some people will want to circle back and elaborate, and we'll set up an appointment to get coffee at the local coffee shop and have a conversation because this is about engagement and dialogue and conversation and so like if you want to have that, I'm willing to have that.
Yep.
I don't want sometimes always like you get angry emails and like but there's no opportunity for engagement. I'd rather have the opposite where we are engaging in thoughtful conversation, and it's easy as sending an email and then engaging further in more conversations.
Excellent. What you said there is funny. Like our listeners definitely take to heart what Senator Huxtable is saying in terms of it's not just having the conversation and the ask. A lot of times, put the perspective of you're going to educate Senator Huxtable on home care. And I've been in meetings with legislators and I say I'm with home care. They literally think I'm like representing people that are fixing houses. Like they, it's just, it is what it is. You're not just advocating, you're bringing awareness to what your issue is. And your legislators want to learn about what it is you
Yeah.
do and what you do in their district and help them. So definitely do not be afraid to have those conversations.
Yeah, and
Uh,
if I may, can I
yeah,
add one thing to that
please.
too?
Yeah.
Sometimes I think folks may think we're an expert on everything that's in our codes. And so they're like, we need to do something about this. And it's like, okay, but sometimes they might know, like, no, if you changed, this in code, that could be helpful for us. That's so also pointing me in the right direction instead of like just giving me the broad issue. Like if you can also hone it down and say, like, if you made this change in Delaware code, this is the opportunity that it could provide.
Excellent.
Yeah.
So home care in general, what is your personal experience related to home care at this point?
So interesting conversations that we're having. My parents are currently discussing options on what is in their future. So I don't have any personal experience currently with myself with home care, although I have met with constituents who are utilizing home care services. In fact, even in my prior work before joining the state legislature, I worked for nonprofits that helped folks who were in the home healthcare field achieve home ownership. And so I got to engage on the provider side of things with those folks who were seeking to put down roots.
Excellent. All right, so we did the nice overviews and experience. Now we're going to get to the nitty gritty. Now's the
Okay.
tougher questions. We're going to try to answer for our listeners to get a perspective on the hard part of home care, the workforce. They've
Mhm.
The shortages have driven declines in Delaware home health referrals and increased costs for agencies. How do you see workforce challenges affecting the state's ability to realize cost savings from home-based care?
It's a very deep question. And we certainly are trying to build the healthcare workforce here in the state of Delaware. I've passed some bills related to studying that what the healthcare workforce is like in the state of Delaware. But I also think it's and I'm going to tie this to my prior answer regarding my prior
Yeah,
work. We have some healthcare shortages and other sort of shortages because where do jobs go at the end of the day? They go to a home. And
yeah,
if we don't have the housing for the workforce, that workforce will move elsewhere. And in Delaware, we have a challenge, as most states do, but we have a challenge with affordable housing and housing opportunities. And so I don't think they're not they're certainly related
yeah,
and how we address it. So it's not just like, hey, I'd certainly like to build up the workforce and study the workforce and figure out how we can incentivize more people to go into this caring field. I mean, you are caring for your neighbors. I
yeah,
mean, how wholesome is that? Um, but then if you also, as a community, if we don't care for them and provide them a place to live, like that's not that like we need to reciprocate the care
yeah.
that they're providing to our communities by the communities providing the housing that's needed for that workforce. They go hand in hand.
Excellent. In terms of legislation, you talked about different legislation you're involved with. So you sponsored Senate Bill 122, which enhances Delaware's healthcare workforce planning. How can improved workforce data help the state identify opportunities to reduce costs through expanding home community-based service?
Yeah, so this is I'm going to call that bill the feel good bill of last year, although I
Awesome.
imagine a lot of people are going to be claiming that with the bills that they run as well.
Yeah,
Um, but this is a bill that is really quite simple. It's requiring DPR, Division of Professional Regulation, to ask questions during licensure and relicensure processes to get the data that we need. So, folks like myself, legislators, or people who are in the healthcare workforce field, can actually do better policy by understanding the data. We
yeah,
aren't collecting data in the granular ways that we need, and as we are developing as a community, as a state, our challenges are different, and we need like greater data, and this will provide that. So we're not working in a vacuum. So we know um, where people are going in that workforce, where we have gaps in that workforce, and if we incentivize certain aspects of creation of jobs in that particular category, then I think you'll be able to like more clearly find out what sort of savings that we have on an
yeah.
overall healthcare basis. And I think we're working on some additional legislation that might also just incorporate, you know, more data because that's what folks are craving as they're studying these issues and not just wanting to like throw darts at the wall. We want to actually, be thoughtful in our processes to care for our Delawareans.
Yep. It's it's true. It's one thing we repeat a lot in general when we're out in the community doing advocacy on behalf of clients and staff, and even on different episodes. We always talk about the story is the most important leave behind. If I'm going to meet with you, you're going to have meetings with other groups that aren't home care throughout the day, but if that personal story is the one thing that we want to resonate with you so you remember us. But the facts and data, getting it right and getting as much of it as possible to leverage the opportunity for increases for home care, vital. I can't reiterate enough what you're saying. We know that we need to prove and not just say or throw darts that you're mentioning or say it hurts, but how does it hurt? That data really is vital to us. So we realize it on our end too. We are very hungry for it when we advocate and educate others to go out and do these same meetings.
Yeah, it's not an either or situation. It's
Yeah.
both. You need to have those warming, grounding stories
Yeah.
backed up by data. I used to be a nonprofit person, and I remember speaking to this one group. It was like, we need more data. And so the next time we came in with a proposal and we had all this data, they're like, "There's no story." Like I can't like okay. So do you want the data or do you want the stories? And now we're like, well, we're going to give you both, and so you have no excuse.
Yeah. Yeah. At Hearts for Home Care, you visit any advocates that visit you, they'll have it
Hmm.
down. We
Yeah,
teach the advocates to go out with that order, so that's good.
yeah.
Uh, Sticking to home based care for one more question.
Okay.
With the cost rising faster than inflation, the inflation word is probably you hear that a couple times a day. How can Delawareans ensure that expanding home care still generates savings for the health system?
I think there's some measures that we're taking on as far as looking at the hospital systems, those sorts of costs. But I think we definitely need to look at the entirety of the system. Um, so I'm gonna repeat Governor Meyer, who's repeating Governor slash Senator Carper, and it's like we want to do the thing like we want to do things that are like doing good and getting great results. We want to do more of that, and the things that aren't producing and aren't producing the right results, we want to do less of that.
Yeah.
And I think we have a story with home healthcare that providing the services in someone's home where it's warm, it's familiar, it's safe, has inherent cost than an institutional setting that costs thousands of dollars a day, and depending upon what those services are. And people want to be like, no one, I don't think I've ever heard a story of somebody like, I want to be in the hospital. People like, no, they usually say, I want to be home.
Yep.
And how do we provide that dignity and care to provide those services in their home for their comfort and like the savings the savings is just on like I guess maybe the bonus on top.
Right.
I'm not sure if I really want to say it that way, but like care for the person and dignity in their home, I think is paramount.
We
So
yeah we go back to Dorothy all the time. There's no place like home. No place like home.
right. I had an experience when I worked in college when I was working down in South in Appalachia, and we were it was an emergency home repair program where we're helping like with floors, insulation, roofs, you name it.
Yeah.
And gosh, I remember them. Faye and Cecil. We went to their house and they needed extensive amounts of work. But Faye was dying. She was being fed through a tube in her stomach, breathing through a tube. And but she also knew um, that she wanted to be at home when she passed. And she also knew that the home was not safe for her child, who she wanted to have after she left. She wanted to know that her
Yep.
child was being taken care of in home. Um, and there was one week where we had to do a lot of work in the living room where she was in her hospital bed. And so the family said, "Look, we will take her. We'll take her to the hospital for this week. You do what you need to do. This is what Faye would want." So we put a couple crews in there. We did as much work as we could. We got it uh, this extensive amount of work, and so
Yeah.
we were in there, and we did that so she could make it back home because she was dying.
Yeah.
And in fact, actually, um, after that week of service that week, we found out she actually did pass away on the next Sunday. Um,
Oh,
but we know it, like that's what home means. I mean, it meant so
it
much for
does.
her, and she wanted to come back. And um, yeah, it was, uh, and I feel bad that we couldn't, like, there were complications and she couldn't come home, but her family assured us that she was at peace with the work that we were doing, the purpose of why we were doing it, and the relationship that we built. um, I think meant a lot to them and that family. But I think it just illustrates as far as like what the power of home means to somebody,
Yep.
especially going through a case where, you need in-home services, and the relationships that you build, that these caregivers build with their clients. It's not, it's personal. It
Yes.
becomes like, I imagine that it becomes almost like family. Um,
Yeah.
and there's a strong mission that I find comforting, and knowing that people are doing this for the right reasons and for these families. It can mean so much.
Yeah. The community and Faye and everyone appreciates hearing those stories where honoring, their wishes, their final wishes, uh, relating to the home is one, or they're ones that we want to hear over and over again. So we appreciate you adding that. That was great. And we are thrilled that you joined us today. And our listeners are thrilled that you joined us and gave us different perspectives on the entire spectrum of home care from your lens, and then the personal story on what actually happens behind the scenes. We appreciate all of that. Thank you very much for joining.
Thank you, Mike. I appreciate the opportunity.